you doing? Good. That's great. My name is Nurse Reda, and I'm here to check up on you, okay? So, I see that you have just gotten out of surgery. How are you feeling? You're feeling okay? Are you starting to feel any pain? Do you feel like the medication is wearing off? Okay, I'm just gonna look past you and look at your vitals, okay? You're gonna hear some beeping noises from the machine. I'm just gonna turn it up so I can monitor your vitals a bit better just in case they change while I am doing some intake for you, okay? Yes, and then it'll be done and you can get some rest. So I'm just going to turn on the machine here. This is the monitoring machine. Okay. I could turn it down a bit if the beeping bothers you. Does it bother? No. Okay. Okay. So I am just going to feel around your surgical scar and see if there is any pain. So just let me know if it's painful. And I'm gonna like deeply palpate, okay? Good. And are you feeling any pain? Okay. Great. The area feels pretty good. I am just going to take my pen light here and I'm just going to look at the scar and see if I see any signs of infection showing up, okay? Okay. So, I just want you to lay back for me. Good. All right. Now that you are nice and laid back, I'm just going to take a look here. So, the scar site is looking pretty well. Yeah, I'm not seeing any issues or anything of concern. Alright. Oh, that looks. Let me. Okay. It seems like a stitch is coming up here. Does that hurt? Oh, it does hurt. Okay. We're gonna need to up your pain meds. And then take care of that stitch. Have you been twisting and moving around a lot since you've gotten up? You have? Okay. So we don't want you to pop any other stitches. So please just try to relax the first couple of days, okay? Let your body heal and get back to normal. Good. So, yeah, you felt something kind of pop when you went to lay down. Yeah, that means you must have loosened it walking around. Okay. So your stitch seems to be the only issue. Okay, so I'm just gonna take your temperature, okay? Good. And now I'm just going to go ear to ear. Good. Okay. That looks pretty good. I'm going to put this on the scar, and I'm just going to see if there's any elevated temperatures around your scar area. Good. Everything seems fine. Alrighty. We're just going to test and see if you have any controlled functions or if something is missing. Can you grab onto this as strongly as you can? Good. And good. Now pull it towards you. Great. And over here. Good. And pull it towards you. Great. And now use both hands. Good. And pull it towards. Great. Alright. That seems to be doing pretty well. Now, I am just going to hit around and I want you to tell me if you can feel it. Did you feel that? Good. And that. Great. And that. Okay. And that. Okay. Perfect. You seem to be able to feel that pretty well. Good. Alright, and now what I'm going to do is I'm just going to take a look inside your ears and I'm just going to look for any like redness, swelling, any leaking. Alright, and the outside looks good. And the inside looks even better. Okay, and this way. And the outside looks good. And the inside looks better. Awesome. And so, I'm just going to look in your nose. Good. Let's take a look in your mouth now. I have this depressor. I just want you to say, ah, really wide. Ah, good. Just going to take a look. That looks great. Yep. That looks really good. And so now I'm just going to tap on your teeth. You're going to hear a tapping noise. I want you to tell me if there's any sensitivity that wasn't there before. Yes? No? Good. Any sensitivity? Good. Any sensitivity? Good. Any sensitivity? Good. Good. Now I'm just going to test your gag reflex. Good. And I'm going to push down on your tongue. And I'm going to take my light and I'm just going to look at your uvula. Good. That is all looking great. Okay. And the last thing I'm going to do is I'm just going to scrape you in areas around your scar. And I want you to tell me if you have any sensation of me touching. Okay? Do you feel that? Okay. And what about that? Okay. And that. Good. And that. Great. And that. Wonderful. And that. Okay. That is good. It seems like you're not having any issues. And let me ask you, do you feel weak and fatigued? A little bit? Okay, that is to be expected after surgery. I know that you're able to get up and walk around, but how well are you able to get up and walk around? Pretty well, I would say. Do you feel any tightness at all on that area? A little bit, okay. And on a scale of 1 to 10, how mobile would you say that you feel? Okay. Good. I'm going to turn down the volume on your monitor here. Okay. And Since this is your first day out of surgery, we are going to be monitoring you closely. So please do not turn that off, even if the noise does bother you, okay? You can turn it down, but don't turn it off. And do you need me to call any loved ones? Do you need food, anything to drink? Alright. Well, you go on and have sweet dreams, and I will check on you again in the middle of the night, just to make sure your vitals are okay. I'll just walk in, write down your vitals, and leave. I won't disturb your sleep. Okay. Have sweet dreams. Good night.